Hello. The case study I will be presenting is the undermanaged pain makes for an unattractive patient. The first steps in making an ethical decision is collecting the facts. In this case, at the center of the ethical dilemma is an 85-year-old widow who 6 months ago was admitted to a long-term care facility. She has severe osteoarthritic and osteoporotic pain. She was admitted to the facility because she was over-medicating herself at home, confusing her medications, and not eating adequately. At the time of admission, she was doped up. She drooled and was unable to sit up or eat. The doctor and the family were reluctant to give her strong pain medications. She currently is taking 2 Tylenols every 4 hours, which does not control her pain. She's in too much pain to walk or sit. She prefers bed rest and frequent repositioning. The family has labeled her as a complainer. The staff feels she is demanding and hard to please. The patient's sister called the state regulatory agency to complain that the facility is neglecting the patient and not taking care of her pain. The son tells the doctor to order pain medication to make her comfortable, but something not so strong. The doctor orders an NSAID. Then after 2 weeks, the patient has dark, tarry stools and suddenly vomits blood and is hospitalized for severe gastric bleed. The ethical principles involved in this case study are autonomy, beneficence, and non-maleficence. The approach to ethics I used is the rights approach. The patient has a right to choose for herself. She has a right to make her own decisions. She has been verbalizing her pain. She has a right not to be injured, yet she is not receiving adequate pain control to make her comfortable. The staff failed and demonstrated beneficence, which is the principle of doing good, demonstrating kindness, showing compassion, helping others. The staff should have advocated for the patient when the Tylenol was not providing pain relief. The patient has been verbalizing her pain for at least 6 months. The patient's sister demonstrated beneficence when she reported the facility for not taking care of the patient's pain. The physician and the staff failed in their primary obligation to do no harm. Non-maleficence is the ethical principle that requires caregivers to avoid causing patients harm. Acetaminophen is the first-line treatment in the management of mild persistent pain in the older adult. But this patient has severe osteoarthritic pain. She was probably on high-dose pain medications prior to being admitted to the facility. The physician should know that acetaminophen lacks significant anti-inflammatory properties, making Tylenol less effective for chronic inflammatory pain than NSAIDs. A maximum Tylenol dose less than 2 grams per day in frail patients and in those over 80 years of age is a maximum safe dose to avoid potential liver toxicity. This patient was receiving 3.9 grams per day. She should have had lab work to assess her kidney and liver function since she was on Tylenol for 6 months. And as a routine, most patients do have lab work done every 3 months. The staff should have reported to the physician the lack of pain relief for the patient, altering her function and quality of life. The physician should have tried other avenues for pain relief in a stepped approach or consulted pain management. Due to the lack of implementing these principles, the patient developed a severe gastric bleed. Therefore, we should be mindful of the ethical principles of autonomy and beneficence and non-maleficence when we treat our patients. Thank you.